think we are live.
Are we live?
Mm-hmm.
We're live. Okay.
This is exciting.
This is. All
Brings me
right.
back to days doing theater, and I'm like, okay, curtain up.
Curtain up.
Go.
All right. We are just waiting for folks to join.
Welcome.
Welcome. Right. Get a few more minutes. Hello, everybody. Thanks for tuning in. We're going to wait a few minutes to get some more folks on the line before we start.
Mm-hmm. We'll introduce ourselves then, but it's exciting to be here and get to share knowledge and information.
Yes.
I am going to rep our new swag because I love these cups so much. It's very durable,
nice.
Essential. Yes.
Oh, really
They appear to be
rustic.
holding up in the dishwasher pretty well too, which is a surprise.
Hi, Amy.
Hi, Amy.
Thanks for joining. All right.
Perfect.
Well, we'll go ahead and get started as folks tune in on their lunch break, likely. I'm Shannon Miller. I'm the Director of Communications at Essential Health. I'm here with Dr. Elizabeth Sierakowski. She is the owner of Essential Health here in Raleigh and practices here. And she is trained in family medicine, integrative medicine, functional medicine, and has a clinical focus on advanced lifestyle medicine, cellular nutrition, gut health, hormone balancing, anti-aging, adrenal health, thyroid imbalances, among the wide variety of other areas of health. So we're here to kind of address some of the questions that you guys have submitted. Thank you for those. They're anonymous. We'll try to get to all of them, but we're going to kind of capture them in a way that moves through thematically. So we'll touch on hormones, gut health, nutrition, other areas. So
It'll be fun.
we'll be organized with it, hopefully. Okay, so I'll let you say anything else you want to say about yourself before we kick off.
Variety is the spice of life. I cannot pick a thing to focus on, but the overarching theme of what draws my attention and keeps me studying and keeps me doing the next fellowship, the next module, is that I believe the toolbox that we have access to is ever bigger. And as a provider, my job is to find access to as many of those tools as I possibly can, even if I don't master them, that I'm aware that they exist and I can point you to the right person who maybe has mastered that particular tool. But my job is really to be as aware as I possibly can to filter things for you. And then the second part, I think, is I always remind myself that doctor comes from docere, to teach, and teaching is the root of everything. To empower you towards your own healing means that you have to understand how your body's supposed to work. So that's really what this is about, and it's not medical advice, right? It's awareness of what's out there and that there's a different perspective maybe than what you're used to. So we're excited to be here.
Yes, very excited. So our first area to discuss is hormone balance. So we got a few questions. Your expertise, definitely, area. So we'll just start with, how do you even know if your hormones are balanced?
It is the question. So there's really two parts to that. There's how you feel and there's data. Historically, we've gone with how I feel, and maybe my provider does or doesn't acknowledge that if I feel unwell, that it may or may not be related to my hormones. And that's really where data comes in, because it's not my job to tell you how you feel. It's my job to figure out why you feel that way. And if somebody doesn't feel optimal, there's a reason, and we can find it. Hormones really are a broad topic. It's everything from sex hormones, which is mostly what people are referring to when they talk about hormones, but there's also DHEA. Vitamin D is a prohormone. There are many things in the body that function in a messenger type way and affect change in the body. But for the purpose of this conversation, we're going to talk about sex hormones. Before we answer this particular question, a brand new headline came out today, which is not news or should not be news, but it's really, really, really important. It's a big win for the functional community because it brings up the question. And the headline was about oral birth control pills, and IUDs specifically were mentioned, but that contraception, hormonal contraception, is associated with an increased risk in breast cancer, 20 to 30%. Now, that's one study, right? And we can certainly talk about statistics and how they can effectively be used to prove anybody's point, no matter where you are on a spectrum of things. But it is very important to understand that hormones are associated with risk across the lifetime. And why this feels like a win, and obviously I don't want anyone to have a bad side effect from a hormone. I want people to be aware that the risk exists so that we can have that conversation. Historically, contraception has been dismissed, so everybody should take it, don't ask questions, don't read the insert, no, it's not making you foggy or gain weight or have a low libido or have acne or any other things, because it doesn't do that and we're just not going to talk about it. But hormone replacement therapy in menopause and andropause has been maligned, and the benefits absolutely undermined and the risks absolutely over-exaggerated. And so you end up with a hypocrisy of hormone replacement therapy here is perfectly safe, don't ask questions. And hormone replacement therapy here is never safe, never do it, you're a terrible doctor, stop. And that's ludicrous. They're both helpful, they're both risky, and we have to understand where you are in your life, in your risk, in your family history, in your personal risk, and your lifestyle habits, and how all of these things come together. And so when someone asks me, should I be on birth control or not? It's a really big question. Or what kind should I be on? Or what does that look like? Or should I just do the family planning method? Or yes, maybe, right? So that's why when people say, what on earth do you talk about for hour-long appointments? Everything. We talk about everything. And that's not just me, that's all of our providers. It's what we specialize in. So back to the how do I even know if they're balanced or not, we test them. Yeah. If you're not on hormones of any kind, then blood samples are great. So we just measure how much estradiol, testosterone free and total, progesterone, DHEA are floating around in your system. And the LHFSH, luteinizing hormone, follicle stimulating hormone, that come out of your brain and tell your gonads to do something, anything, those go sky high. In menopause, yes, andropause, but other circumstances as well, where the brain's screaming at the gonads to make more, or they're very low. And anyway, so there's a whole cascade that we're looking at. And then we're also looking at sex hormone binding globulin, because that's a sticky protein that comes out of the liver and sticks to testosterone. So even if your levels are normal, the freely available part might be low. So we're looking at all of that. We also measure other nutrients and things that can directly impact. So cortisol being number one, right? If someone has a lot of duress on their system, on their body, and that can be mental stress, but it can also be physical stress. If someone's in chronic pain, for example, or they have a very toxic lifestyle, someone's drinking a lot of alcohol, that alone will drive cortisol changes, will drive any testosterone that you have to aromatize down into estrogen, which actually I think was another question about how men have estrogen. So men and women both have all of them, right? It's not like women only get estrogen and men only get testosterone. And that fallacy of thought is what has led a lot of us to imbalance. But men need more T and less estrogen. Alcohol and excess body weight are two of the main reasons why we're driving what we call aromatizing, so taking testosterone and turning it into estrogen in your body. So when I see a man with a normal testosterone, or even low, and really high estradiol, my first questions are, how much are you drinking? And if the answer is, I'm really not, and I'm not overweight, then we're looking for other sources of what might be driving that metabolic change. And that's where we're looking for more data and having a deeper conversation. In women, I think there's another one about
testosterone.
These all connected. Yes, everything is connected. Yes, women need testosterone, and not the amount that gives them acne and facial hair, right? Like that's not what we're aiming for here, and we're not trying to roid rage anybody out. Men also should not have that level of testosterone. It isn't the cure-all, and I think this is where some people get misled, either through the internet or what they're looking for, or even in other providers, because it feels good to get this burst, right? But just like women know, it doesn't feel good to be on a roller coaster. Any woman, like, please get me off of the roller coaster. This is not great. So in proper and healthy hormone balance, we're avoiding this. I don't want to spike you and then wait until you're down in the toilet and then do this again. That's not safe. And it's not very effective. The goal is steady, at least mostly steady. So for women, all the same reasons that men need testosterone. We think about T and libido. Yes, and it has been game-changing. I mean, the number of women truly who have said that this therapy has saved their marriage, and it's not because they're having more sex with their husbands. It's because they don't feel isolated. It's because they don't feel like they're fighting an uphill battle about a thing that they feel like they want and they don't want, and it becomes this, what's wrong with me, right? And so getting back to a place that's balanced is really important. And there's a lot of reasons for people to have low libido. Testosterone does not fix them all. It does not. So the other things that I'm looking at for women with testosterone really are, how are you thinking? Are you feeling sharp or are you foggy? How are you recovering? Can you get to the gym and feel like you're motivated to do it? You feel good when you exercise? You recover after a day? You're not, I go to the gym, I'm exhausted, I'm dragging myself there, I'm white knuckling through the workout. It takes me 3 days, I'm still sore, and it's just not fun. Those are great signs that T may not be where it needs to be. So when we add it back and balance, right? So if someone's like, I have all the symptoms, but my testosterone's perfect, there's something else. It's not that. I'm not going to continue to over-treat something that doesn't need to be treated. But that category of things is really important. I find that besides libido, the biggest benefit that women get from testosterone is the cognitive function. So this idea that happens, especially, we think about it in menopause, but testosterone is separate from the menstrual cycle. So it really shouldn't be having massive swings up, down, and all around. And even in a menstruating woman who's in her 30s, this one, it can be really low. And there are things we can do about that. So I don't think anybody asked, but I'm going to share anyway because that's what I do. Things that you can do without needing or going to a hormone replacement therapy program. Number one is body composition. So this is where excess body weight versus muscle mass is a really important question. And you cannot know that based on a number on the scale. You cannot. So this is not about your BMI. This is about body composition, which means you have to go somewhere that has a scale that measures your muscle mass. Hands down. I care more about how you function than how much space you occupy. They are not the same question. So we really need to move that conversation. And muscle mass is a big one for men and for women. So as we have less muscle mass, we are making and utilizing less testosterone, and we're turning more of it into estrogen, which makes people, frankly, moody and not feeling that great. Estrogen's good. Too much is nobody's friend. We're aware. So exercise is a big one, and then there's some supplements that are really helpful, but I don't recommend taking a bunch of over-the-counter supplements to raise your testosterone without a provider and without measuring. You can absolutely hurt yourself or be turning it all into estrogen. Not helpful. So please measure and go talk to somebody before you take things off of the internet.
Yeah.
Thank you.
Yeah, come talk to her. So yeah, well, you started off, talking about birth control.
Yes.
How could somebody safely get off of birth control?
Excellent. So 2 major questions, and I want to be very clear. I do not poo-poo on birth control because it has been an absolute game changer for the lives of women. To be not pregnant when you don't want to be is game changing. It lets women go to school. It lets women have jobs. It lets women make the choice for whatever reason is their reason, right? So being able to decide when you do or do not want to be pregnant is really important and cannot be understated. So it's one of the things that we look at when we say, is the risk worth it? Yeah, Sometimes, right? In the spectrum of least risky to most risky, least risky would be things that involve nothing that interferes with your body. So abstinence and the symptothermal method, also known as natural family planning. I do want to touch on that. It's really important that people understand it's a little complicated. You can absolutely learn it. It takes practice and dedication. You can, and it takes practice and dedication. So a lot of times where women go wrong is they think, I'm just going to stop my birth control and then map my periods, and I'm mid-cycle, so I must be ovulating, or I'm not mid-cycle, so I must not be ovulating, and they get pregnant. Or they don't get pregnant when they're trying to, because it takes time to learn your body, and we are more than when we bleed. You are more than when you bleed. This is really important. So the natural cycle of things is a little complicated, but the 3 components to a good symptothermal method would be basal body temperature. So you have to check your body temperature every day before you get out of bed, because once you're up and moving around, it's not as accurate. Vaginal body temperature is actually the most accurate, but however you're going to do it the same way every time. Do not use one of those forehead things, please. That's not accurate. Check your calendar so that you know when you would expect a period, and you have to check cervical mucus. This is many articles out on the internet about how to do this, highly recommended, and then just start paying attention. But what I love about this method is we know our own bodies. It teaches you more instead of suppressing and hiding. It's awareness of, this is dry, this is lotionally, this is stretchy and slippery like lube, fertile window, right? Even if you just had your period, even if you're not in the, it's helpful. So I love those methods. IUDs, patches, rings, shots, pills, right? There are a lot of methods. Each one really comes with its own risk and benefits, so I would recommend that is a conversation someone has with their provider. There is a non-hormonal birth control method or device, that's the Paragard copper IUD. Some women don't tolerate them because they are mildly inflammatory on purpose. That's what makes a hostile environment, which all sounds very aggressive. Many women tolerate them beautifully, but the most common side effects with that one are heavier periods and more cramping. So not everybody likes to go that route. I went that route. It feels the safest for me. I know I'm not getting hormones that I don't need, and I'm not going to get pregnant when I don't want to, because like a lot of women, I have a lot of sensitivities, and so some of the topical things like spermicides and condoms and female or male, however you want to do that, they're irritating for a lot of women, and that's another thing that's not well talked about, like why am I getting symptoms or itching or floral imbalance that's a risk, and one that we need to talk about. So each woman's body is different. Knowing all your options before you get off birth control, circling back to the question, that's really important. You have to know what your plan is. You can't just stop and not have a plan, unless not having a plan is in your wheelhouse right now, that's okay, that you could be pregnant or not pregnant, and that's fine. Or if you're not having intercourse and you don't need a plan, then it's fine, right? But I need to make sure that women know what the next steps are and what they're going to do about it. In terms of coming off safely, it depends a little bit on the type. Depo shots tend to take the longest. They're effective, but they really mess up women's hormones. I haven't seen or done one of those in a very, very long time. An IUD or an implant, the Nexplanon has to be removed by a provider. That's the little device that gets inserted under the arm. IUDs also need to be removed by a provider. Please don't pull them out by yourself. Please don't do that. Bleeding can happen. It's not, anyway, go to the provider. Those can be pulled anytime. And then usually after an IUD, a woman is fairly fertile pretty much right away. So like, be aware. There's no, can't get pregnant for a couple of weeks. Not true. True for a lot of other things as well. Even oral contraceptives. Some women, it takes a long time to regain fertility. Some can miss or be late an hour and get pregnant, right? So just being aware. Oral contraceptives can be stopped. They don't need to be tapered or anything like that. I tend to recommend stopping when you're going to have a period anyway. Because if you try to stop mid-cycle, you'll force a period, and then you're off, and it's just odd. So you can, but it's not comfortable. So just like you start when you have a period, you should stop when you have a period. And if you're on one of the continuous, then it doesn't really matter when you're ready.
Okay. Are we good on hormones?
Yes. I mean, no, I could talk for many hours.
This could be a 3-hour live.
Many hours later.
Yes, the next question topic area really is more about navigating medical guidelines. So,
yes, I had one. There was a question that came in, and there are new guidelines coming up that I wanted to address. Yes, it's really, really important for any person getting mammograms at this point. So if this doesn't apply to you, but awareness, there is a new requirement that any woman getting mammograms, that the report include information on her breast density, and that if a woman has very dense breasts, the recommendation will then be to get additional imaging. I wanted to talk about this because it's new, so it's going to freak a lot of women out that all of a sudden somebody cares about their breast density. Mm-hmm. We've all seen for a long time that many reports just everybody has dense breasts. Mm-hmm. Very, very rarely anymore do I get a report that doesn't say that. So I think there's two parts to that, which I'll keep it short because I could go down a rabbit hole on why I think women have dense breasts and endometriosis and fibroids. But there's a piece to that, and I think that we probably do have denser breasts than women did historically.
Interesting.
Which is related to estrogen. So too much estrogen or imbalanced estrogen, estrogen's a growth hormone. It makes things grow, which can also be tissue density, fibroids, endometriosis. How and why we have too much is a whole question. Is it hormonal birth controls? Is it hormones in our food? Is it that we don't detox very well? All of the above, right? Side note, which maybe we'll talk about later, but how we get estrogen out of the body is through your poop. So if you don't poop, you're not detoxing estrogen well. It's very important. I had a hilarious conversation with a patient of mine yesterday, and we decided if I ever write a book, it'll be Poop is Always Involved. Will be the title.
It all comes back to
it. It always comes back there. It's very important. But the new guidelines on the breast density, so you'll see breast density on the report for everybody, and if it says very dense, the next recommendation is to get an MRI. We're familiar with mammogram plus ultrasound. Now it's mammogram plus ultrasound plus MRI. There's a lot here. Every single person's risks are going to be different. Every person. You have to have a relationship with a provider that you can have this conversation with, because, and where I wanted to talk about it, there's two things that are very important here. And this is where statistics and testing, it's complicated. And I'm going to break it down into the fishing net analogy because I find that it's the most effective, but this is a hard concept for medical students to learn. Like, we get it wrong a lot until we are drilled in how to get it correct. But stats are hard, and they can really be twisted and not understood very well. And all of this is important because that's how, as doctors, we decide if a test is worth doing. Sensitivity and specificity. Will it catch everything? And will it catch only the things I want it to? That's how we decide. I would love to say, and this is true for our labs, for everything, unless it's a pregnancy pee stick that's very specific for on or off, most medical testing is not that. Mm-hmm. It's not. It's mostly accurate, and it might be right. But we have to leave room for the possibility that it's wrong. Mm-hmm. And that's hard. You're like, but the test said I had, and it might have been wrong. So this is especially important when we're talking about cancer, because we make decisions on the next step based on the imaging and what it shows or doesn't show. So mammogram is, depending on who's doing it, it's around 70% effective in terms of sensitive, that it's going to catch a cancer. You can imagine that if tissue is really dense, it's hard for them to see, and that's where they're going to say, this imaging is not good enough for your breast tissue, so you should have different imaging. Great. Ultrasound, helpful. MRI, most sensitive. So this is going to be the biggest fishing net that's going to catch everything, which means it's going to catch things that aren't cancer. And you don't know, based on that imaging, if it is or it isn't, until you go for a biopsy. And so what happens, and this is where I wanted to look, how specific it is. So it'll catch almost everything, like upwards of 90% sensitive. Specific, whether something is truly a cancer that is a problem, as low as 30%. 3 out of 10. So no, not every woman should be getting an MRI. That would be terrible. Everybody would be getting biopsies that don't need biopsies. So if you are high risk and your tissue is dense and you've talked about the risks, maybe, right? And then how often? And right now the recommendations are every single year. But the problem is breast MRI is known to be associated with more biopsies, 25% more callbacks, and an increased incidence of mastectomy across the board. Whether someone, doesn't matter if they do or don't have cancer. So women are more likely to get mastectomies if they get breast MRIs, regardless of their actual cancer risk status. So all of that just needs to be talked about. And then part of this too is an MRI requires gadolinium contrast. We don't know the real effects of gadolinium done over time. So one MRI, if you have high risk and dense breasts, worth it? Yeah, probably. Every single year, we don't know. And historically, it was poo-pooed, like a lot of things. Nope, not toxic, I'm sure it's fine. And now it's coming out that it can be, and that the gadolinium can stay in your tissues a long time. And different people, different amounts. So we don't know, because I wish I could show you, on the back of this computer is a sticker that says N equals 1. This is really, really important. In medical studies, the N is the number of test subjects, and they can be in the thousands, and that's the most powerful, greatest study because you have all of this information and you're taking data out of this aggregate. But it may or may not apply to you, because your set of circumstances, your chemistry, your genetics, your bacteria today are different. So anyway, I think that it really comes down to awareness. It doesn't have to be scary. Have a conversation with whomever is your provider about your risks and your benefits, just like the birth control conversation. It's just about having the conversation. All of this should make us ask more questions. That is how we science, to ask questions. So that's a good thing. Okay.
Yes. Okay. Thank you for that. I learned a lot.
I feel very passionate
yes.
about this.
So we're going to move on to nutrition. We got a few questions. First one was about glucometers. What are they? Do we need them? What's the hype?
All over Instagram and everywhere. Yes. And we use them in our office. So glucometers are a way to measure your blood sugar all the time for 24 hours. And they last for a prescribed period of time. They are a little device that has a needle initially. It pokes into the back of your arm. The needle comes out, but it leaves a sticker, a sensor device with a little monofilament, a little plastic, I don't know, how do you describe monofilament? String?
Yeah,
a little plastic string. Yes, that goes underneath the skin and stays there for 7, 10, 14 days. And over that period of time, it's sensing the blood sugar that's floating around in your lymph tissue. So it's not in a blood vessel or anything like that. It's just a sticker on the back of your arm. And there's no needle, so it's really important. Not after it's on there. You shower with it, you do sleep on it, whatever. They are only so accurate, so they're very helpful for trends. They're not made for diagnostics necessarily, especially if you get down into the hypoglycemia levels. We've proven it's good enough that it'll show you that you're tanking, but that level may or may not be accurate. So they stop getting as accurate when you get down into the low levels. So we love to use them for trends. I very specifically don't use them in people with an active eating disorder. So there's a lot that needs to be talked about here. But it's a really, again, important conversation. I like them with a provider. I don't as much like these ones that are an app that are making you more and more and more aware of exactly what you're eating and exactly how it makes you give data at any given point in time. It can be helpful as an awareness. So if somebody's really out of touch with their food and they really don't understand that if they chug a bunch of orange juice that they're going to spike and crash and not feel good, it can be helpful. But if somebody's fine-tuning, it's not my favorite, because I have seen too much badness come out of it and hyper-awareness of habits instead of using it for health and wellness and optimization. So I love them. They're great for trends. They're useful in most people. Mostly here, we use them to differentiate between people who have an A1C, a 3-month blood sugar average, or blood sugar that's climbing because of diet, or climbing because of stress.
Mm.
And people don't believe me. They're like, it must be something I'm eating. I'm like, it could be not. It could be not.
Yeah.
It could be because you're in your head all day.
Mm-hmm.
And that's not you against your body. That's team body being like, Elizabeth needs a lot of brain energy all day, every day. I'm going to keep her a steady drip of sugar going, and it's going to be great. That's effective.
Mm-hmm.
The problem is that I need to take a break.
Yeah.
And so I use it to teach us that and to use it as a teaching tool for people.
Yeah. Great.
So I love them.
Okay. All right. The next one is about fasting. So should I be fasting? Does skipping breakfast count as intermittent fasting? All these questions around the buzzword of fasting.
Dave Asprey will tell us all that if you just skip breakfast and drink his very special coffee, that we will all live to be 148 years old.
Mm-hmm. Heard that.
I like bulletproof coffee. I do. It's a separate topic. But I have seen over and over and over and over again, skipping breakfast, rarely effective. Rarely effective. Because what you're doing is you're eating at night because you're hungry, and then you go to bed with a fairly full stomach, which interrupts your sleep, so you're tired. And you get up and you skip breakfast and you just have your coffee because you need to be awake, but you've already not eaten for 10 hours. And now you're going to function and be cognitively sharp and on with no fuel, maybe exercising, and you're getting yourself to lunch and you're busy and you're stressed, but you're still not eating. And then but you're not hungry, right? I always hear that. I'll come back to that. It's because you are out of practice, because you've trained your body to not be hungry. It's the other way around. Tell your body what to do. Don't get led along by your nose. So now it's after lunch and you're hangry. You're tired, you're cranky, you're brain fogged, because you haven't eaten since yesterday. This is a problem. And then you try to cram all of your eating into the end of the day when you no longer need it. So what is far more effective is if you get up and eat some food. It can be light. People are like, it seriously makes me nauseous to eat in the morning. Like, then do something light. Do the bulletproof coffee. That's great. That's fat. That's not fasting, right? You've got fat in there. You've got some protein with your collagen. That's great. Eggs, whatever. But some protein and some fat in the morning. Eat a lunch, a real lunch, with protein and vegetables and fat, and then a light dinner as early as you can, and be done. And if you're going to have alcohol that day, have it with your dinner and be done. Do not trail this down into 9, 10, 11 o'clock at night. It's a problem. You will interrupt your sleep. You will not function well. So yes, fasting is great for most everybody who has metabolic flexibility. If you're somebody who gets shaky and uncomfortable and panicked, if you skip a meal, talk to one of us. That's not normal. You should be able to skip a meal or delay it for a little bit and have your body not freak out. So if you're in that place and you train yourself over time, don't make all of these all at once changes. You will feel terrible, right? You have to adjust. Your body is not a machine. You don't push a button and change things. You have to take your time. But eat breakfast, eat lunch, eat an early dinner, and be done for the day. And that counts as intermittent fasting.
Okay.
Yes. Longer fasting under supervision, please.
Yeah. Got it. So kind of related, but weight loss. A lot of women are frustrated when they see the men's scales tipping faster and greater.
Terribly unfair.
Yes, terribly unfair. So why is that?
So it's not always true, but it is really common that men lose weight and optimize body composition faster and easier than women. Largely muscle mass. It's mostly muscle mass. And testosterone. So if a woman has very low muscle mass and she's trying to eat less and eat less and eat less, because we still have this idea that the calorie deficit is how we're going to make this happen. All you're doing is training your body to function on less. So it's going to get more efficient. And now you have even less wiggle room because you have even a little bit, and your body's like, oh, a smorgasbord, I'm going to pack it on because we're going back to less. This is the yo-yo dieting issue. Women more likely to have dieted, slowed their metabolism down, and have lower muscle mass. Men, less likely to have yo-yoed, more likely to have more muscle mass and try to exercise off weight versus undereat off weight. So that's why, over and over and over again, it's easier and faster for men and it's harder and slower for women. Fuel your fire, ladies. Stop undernourishing yourself. Oh, I'll use my hands, it's very effective. Your productivity is up here. You have demands on yourself. It doesn't matter if it's kids or work or ideas or creativity, whatever it is, your demands are way up here. And always when we're way up here and our demands are way up here, we think, you know what I need to do? I need to eat less. I need to nourish myself less. I need to exercise more and have more demands and then eat some less, right? This is not effective. It's not effective. Please fuel yourself. You will maintain metabolism better. You'll stoke the fire, which means everything you do is that much more effective. The weight will change. You will optimize body composition, but it's back to muscle mass. More muscle, less restriction.
And it takes time for that, too.
Yes.
Yeah.
Yes. We have very skewed ideas of shifting and what to expect, and a lot of that is marketing, right? There are devices and drugs and diets and all the things that will tell us that we can lose it and we can lose it in X period of time. And again, it's not the right emphasis. So we try to come down and come back and come down and come back, and it's not helpful. Fat loss, muscle mass, fat burning, at most about 2 pounds a week. That's all you get. And I mean, unless there's a major deficit to happen, and even then, that initial major weight change that a lot of people see is loss of inflammation and water weight, mostly. Many times when we're very overweight or just have a very inflammatory acid-producing diet, we're holding on to water in our tissues, and people will feel it. They're like, I just feel puffy or swollen or tight. That's water. That's not fat. Okay, so that change can happen much more dramatically when done correctly, and that's where things like fasting and whole foods ways of eating and other things where you're taking off the inflammatory things and emphasizing anti-inflammatory ones can make dramatic differences. But true body composition change takes time. You're looking at 3, 6, 12 months. Take time. It will last.
Yes. Okay, we had a question about an elimination diet. So what is elimination dieting? Should we consider doing that? And when should we consider that?
The idea has come to light recently that food sensitivity and food allergy are not the same thing. And so a lot of people are beginning to understand that there are foods that don't make them feel well. Or maybe their brain fog or fatigue or their joint pain or their bloating or their acne or pick a feature is related to food. And that's where the idea of an elimination diet comes about. This is something that can be done in light form without supervision, but if you're really restricting whole food categories, or you find that you make a change and it works, and now you're stuck with a limited diet, you need a provider's help. So limited diets are intended for diagnosis. You are not supposed to live there. I've had people come to me and say, I'm on a low FODMAP diet for 8 years. Like, that there's no fiber. There's none. That's not a healthy diet. We have to fix the problem of what happened underneath that got somebody to that point in the first place. So I like rotation diets. Those can be easily and very safely done at home and are great for you. Nobody should be eating the same food every day. So rotation, highly recommended. From an elimination standpoint, you can pick a category like no dairy for a month, a real one, right? So unless somebody's got overt active symptoms, like they're trying to figure out if strawberries are making them itchy, then we're really looking at the long haul symptoms, and you're not going to know in 3 days. If you just don't eat cheese for 3 days, you may not feel any better. So that's more of a long time thing. But I like one category at a time unless you're under supervision. Somebody's trying to take all the top allergens out. Again, you're on a really restricted diet. You're likely to have as much issue from not enough nutrients. And sometimes it's not the food, it's the act of eating. Or sometimes we just need a provider's perspective on types of food versus histamine versus the fibers involved. There's a lot there where guidance can be really helpful.
Great. So leading into gut health, I think we should focus on that.
Yes.
A lot of questions around that. There was one around bloating, so preventing bloat after I eat specifically.
Here's where we're going to talk a little bit about how it's supposed to work. Because if you don't know how it's supposed to work, then it's really difficult to fix it. Your gut is your compost pile. And if you're a gardener or you know somebody who's a gardener, talk about compost because that's what's happening inside your body. And if you don't, I'm going to explain, so don't worry. But there's several aspects of how this happens. How we see food, how we smell it, and that's number one. So that actually triggers hormones and neuropeptides in our brain that tell our saliva to start and tell our enzymes to start going. You see, you're hungry and you see something delicious, you start salivating and your tummy grumbles. That's part of digestion. So start there. Take a second before you just grab something and eat, right? Chewing. So chewing is where we, again, continue these signals and have amylase and begin carbohydrate breakdown, and saliva mixes with food and we break it into smaller pieces. So actually chewing is important. You can't just swallow whole pieces of food. It makes it difficult for your body to do its job. Your stomach should be full of acid, right? And I know somebody asked about Prilosec. Kind of a rabbit hole, but antacids serve a purpose and they should be limited unless somebody has a disease. Like if you have ulcers and your risk of bleeding, yes, take the antacids, okay? Because bleeding in your esophagus can be life-threatening. But if you don't, you just have reflux and you've had the endoscopy and you know that you don't have atrophic changes or ulceration, we need to figure out why you have reflux and fix it, because just making you have less stomach acid means you're throwing water on your fire and then still expecting it to be able to burn things. It can't, not effectively. So you see it, you chew it. Stomach acid really should be breaking down proteins. And what's important, we think about protein like it can melt my chicken. Okay, fine, but proteins are also things like pollen. So if we're not breaking down the proteins that are in our bodies, bacteria, then we get sick easily. We have allergies more easily. So really acid breaking down food and everything else that comes on our food, mold spores, it's really important. Cannot be understated. So dampening our stomach acid day after day after day, not awesome. Not awesome. A lot of times we have reflux not because we have too much acid, but because we don't have enough to digest the material and we end up refluxing this undigested material back up. So it's a weak sphincter, a poor diaphragm tension, not enough acid breaking down the food, poor gastric motility, and filling ourselves to the brim. There's supposed to be room, right? And this is where being careful about portions. It's a great way to think about it is if you scoop your two hands together, about that much food per meal is really actually all your stomach can digest. You could probably get away with twice that. Any more than 2 handfuls of food, you can't. You filled your Ziploc so full that you can't shake and bake any of it. It's just stuck, and it's going to take a long time for the stomach muscle, which really works it's really quite beautiful, but it needs space to do its job. That comes down into the small intestine. You're getting bile, you're getting pancreatic enzymes and breaking down fats and everything else. And at this point, what should be there is paste that feeds your bacteria. So we've absorbed some things, but a lot of the magic happens when really what we've done is turned what we've put into our bodies into food that's appropriate for our gut bacteria in the large intestine. And they do all the magic work where they turn this food paste into soil. That's a good thing. If you think about plant roots that go down into the earth and they have all these little tiny hairs where they're absorbing nutrients and water and other things, we've done the same thing, but we've tucked that up inside our bodies. And that's what inside our colon, in the lumen, in the hole, in the tube, we have tiny little micro hairs, microvilli that are reaching into that substance to pull out what we need. And the bacteria are taking this and creating nutrients for us that we can't make for ourselves. It's amazing. They're helping us to convert our thyroid into active hormone. There's so much that happens in the magic. So understanding how that's supposed to work in the first place will help us to understand why somebody might be bloating, because it can be dysregulated at any step of that pathway. Usually, it's a lot of fiber that they're not used to, So they have fed their bacteria, and their bacteria go, ooh, lots of food, and they make gas because that's what they do, but it's more than you're used to because you haven't rebalanced you haven't given them time to change their population yet to accommodate to what you're eating. So it's going to sound or hypocritical because I said don't eat the same thing every day, and I'm going to say have some routine. Variety within a category is really important, but we really should be eating 6+ cups of produce every day. Mm-hmm. Dr. Wall says 9 for optimal health. I mean, it really, we need a lot. You don't need 1 cup of spinach. You need 3 cups of greens and 3 cups of colorful, like beets and carrots and peas and squashes, and then you need, and citrus and berries, and 3 cups of cruciferous sulfur-based vegetables, your broccoli and cauliflower and kale and Swiss chard and arugula and radishes. That makes the foundation of what we have, of what we eat, and you'll get all of your phytonutrients from it. You add your proteins, you add your fats, you limit the other stuff. Nobody needs goldfish to survive. You just don't. It's fun, right? I don't tell people not to eat something ever. That takes this fun and spice out of life, but it should be less compared to the foundation of things that build healthy compost and a healthy person. So if you're bloating, start with chew better, digest slower, make sure you have enough stomach acid to do what you're trying to do. Digestive enzymes are a supplement that can be safely taken by most people, and they will really help you break that food down further so that your bacteria aren't over consuming some fibers that they are being very reactive to. That's where I would start.
Very good.
Anything more than that, seek help, please.
Okay, you mentioned bacteria. So, question about prebiotics versus probiotics.
Perfect.
Should we be taking them? What's the difference?
Yes.
On that.
Yes. So, the answer is yes, definitely. The answer is always in your poop. So, stool bulk is bacteria bodies. Like 80% of what comes out is dead bacteria bodies. It's supposed to be that way. So when someone's having loose, fluffy, liquidy, floopy stool, they need more bulk because they need to feed those gut bacteria to make more of them to have more bulk. That's where fiber is helpful. Somebody has hard, dry stools, they're coming out like rabbit pellets. The Bristol stool scale is great for helping to identify, like, is my stool normal or not? A lot of times don't have enough digestive power, or they're dry. So this is because if your system is dry, it will take it out of your stool from the large intestine as the last resort, which is drying out your stool. So you have to stay hydrated, you have to stay moving. There's a lot of reasons for constipation. But stool bacteria, enough bacteria, are really important. Probiotics don't fix that problem. Probiotics don't come in and like take up shack and grow. They don't. They're like tourists who come in and have a function and leave every day. That's why you keep taking them. So probiotics are great because they come in and they interact with the bacteria that you have, and they have different effects. Science has not, supplements have outstripped science. So there are a lot of claims for what probiotics can do, and that we can be very specific, and that this strain is associated with this benefit, so now I can market it that way. And association and causation are not the same. So judicious with probiotics, because we haven't caught up to really how they work yet. But a good blend, helpful, sometimes soil-based, like Megaspore is great. Variety, so don't take the same probiotic for 9 years. Like I recommend every quarter to switch, change it up if you need a probiotic. Prebiotics are the magic that feed your bacteria. So a prebiotic would be a fiber, or a supplement, a very specific one, things like large arabinogalactan, or some of the different kinds of carbohydrates that feed the bacteria that are what you're looking for. And those need to be used judiciously. So like we talked about earlier, if you take a whole bunch of prebiotic and a whole bunch of probiotic and think I'm doing great things, you're going to be bloated, you're going to cramp, you're going to have diarrhea, and you're going to be very unhappy about it. So start small. You're fostering an environment. And we have to think about it that way. It's not supplement and action. It's animal husbandry, right? Forest management. That's what we're trying to do. We want to grow the good guys and they in turn help to manage the rest of the population. Which actually, there's another big headline coming out about this weird candida strain, this yeast strain in the hospitals and nursing homes. Everybody's freaking out. It doesn't surprise me at all that there's an opportunistic yeast that is outgrowing its neighbors, because most of those people are going to have poor GI health. They're going to have poor gut bacteria. They're not robust and strong. So an opportunist, which are things like staph and strep and Klebsiella and Candida and yeast and fungal spores, will outgrow because there's no natural predator, your natural bacteria balance, keeping them in check. So all of this is really important. I love both prebiotics and probiotics. They do not solve all things. See point A, go back to eating your vegetables, please.
Okay, parasites.
Parasites.
I did have a question about parasites, and that can happen in your gut. So
yes, parasites are a fascinating topic, and I hesitate a moment because it's really a large one, and I frankly believe strongly that science has not caught up to where it should be for this. So there are not great tests. We have a lot of labs. We're a functional medicine clinic, so I've got a lab binder that's this big of all of the accounts that we have and all the tests that we can do. And there are people who will run DNA tests to see what parasites or worms or protozoa you have floating around in your body. The problem with those, we go back to, remember the fishing net about sensitivity and specificity. These tests are designed to be very sensitive, to catch people who weren't caught with the regular lab. And a LabCorp stool test is not good enough, because you may or may not shed worms in a particular moment if you have an overgrowth. Parasites and bacteria and viruses are part of who we are. I am a collection of beings. You are a collection of beings.
Yeah.
So the goal is not to be sterile, right? We're not supposed to have no worms and no bacteria and no viruses at all. And we're only just beginning to learn which ones are normal, how much is okay, how much isn't okay. And it kind of comes full circle to, do you feel good or do you not feel good? So I don't test everybody for parasites because the tests aren't great. They'll be designed to catch more people. So it'll say you have a parasite when you might not. Maybe you do, maybe you don't. But even if you do, and the test catches it and it's real, how much? Is it enough that we should treat it or not? And the data's not very clear because, frankly, Americans have somewhere along the line decided that we are just very clean and don't have parasites, which is a joke. Like anybody with a pet, you know that you're giving your dog, and I don't actually have cats. I don't know if anybody has cats, if they do this too, but like heartworm medicine every month. Yeah, the tick stuff, but dogs get heartworms. Worms are a thing. And so if you have, even if they're in their little backyard, right? So the same thing's true for people. Parasites live everywhere. If you go hunting, if you go hiking, if you were in a park, anything where you're interacting with other people or nature, which is all of us, we're exposed. So if somebody has a high suspicion for parasites, and frankly it's a complicated question, so I can't just list a series of symptoms that somebody might have, but GI upset and joint pains and autoimmune type symptoms, funny headaches that don't make sense, those are some of the ones, rashes and itching, some of the ones, but a lot of things can explain those. So maybe, and then we look at prescription antiparasitics versus like albendazole and ivermectin, and there's a whole theory for why so many people felt better after taking some antiparasitics. But also herbal protocols. And so a lot of people will do a test, say they have parasites, take these herbal protocols, feel better, and go the rest of their life convinced that they had worms and they treated them and they got better. Most of the herbal antiparasitic protocols are digestive aids. So back to what we talked about, you might be feeling better because you have better stomach acid now, and we balanced your gut bacteria, and you feel better. Wormwood and black walnut hull, these are bitter agents that help improve and enhance Agni, the digestive fire that we talk about in Ayurvedic medicine. So it's a complicated question. They're very real. I think they are grossly underdiagnosed for some cases and probably overdiagnosed in other cases. And it's a bit tricky, is the kind of full answer. But digestive support, always a great idea.
Okay. Shifting a little bit, energy crashing in the afternoon. What can we do about that?
Lots of things. Number one, again, going back to how am I supposed to work and why might this be happening? Circadian rhythm. We have different rhythms in life, but the 24-hour-ish rhythm is one of our most important. We know that the human body, if we were in a dark room and had no idea what was light outside and we were allowed to do this on our own schedule, it's actually closer to 25 hours. So we would get off rhythm if we had no outside input, like Las Vegas. They do that on purpose because they want to keep you awake, right? Mm-hmm. And how do they do it? Bright lights and food. Mm-hmm. Bright lights and food. So we know, and have great science, that the clock genes and the mechanisms in our brain that keep the circadian rhythm going, which is cortisol to get us up, and when the cortisol comes back down naturally, melatonin is allowed to rise and we sleep. So there's a whole thing about sleep. We won't, I don't think, get into that this time. Oh yeah, I talked a lot. Okay. But that cortisol is rising early in the morning is a healthy waking response, and we can motivate that. And the outside forces are daylight specifically, and then meals. So this gets back to why we should eat breakfast. Eat breakfast, please. Wake up, it's important. And then daylight, very different than what's happening in these rooms. Fluorescence, not helpful. Regular light in a room, mostly a cave. There are some free light apps, and you can see how much daylight is in your area where you are versus pointing out a window versus going outside. It's something like 200 lux, 1,000 lux. Summertime daylight, 100,000 lux. So yeah, 200 is like a cave. So we don't get enough daylight in our eyeballs, especially if we're in an office and we're not spending time outside. So this is why the afternoon crash happens. You never got your cortisol up where it was supposed to be, and you burned through it because you didn't eat breakfast and you were really stressed out, and we did whatever we did and run, and then we crash. And that sometimes we get a second wind and we get excited about that and get some more work done, but that's completely counterproductive because now you're suppressing your melatonin and you have to bring all that back down, and we don't sleep. So what we like is wake up, stretch, breathe, daylight in your eyeballs. This is where cold showers are really helpful. You actually adjust. It only takes a few. The first couple are awful, and then they get better after that. Eating breakfast mid-morning, so it's supposed to come down. That's okay. So part of this is expectations, right? That I'm supposed to be like on and then off. And only drugs do that. It's not sustainable, right? So we're supposed to have a little bit of a decline over the day, but mid-morning we can hold on to this more with another shot. So daylight in the eyeballs, breathing, stretching, moving, get up out of your chair, have a snack. A lighter lunch, so you're maintaining, but you're not heavy. And then allow yourself to let go at nighttime. It's supposed to happen. It needs to happen. The sleep balance, all I'll say about this, is really important. We try to drive and sedate ourselves past our wakeful point. That's not helpful. The sleep drive is solid. It's there. You have to reveal it because your wakefulness is way up here. So you're not trying to out-sedate yourself, right? You're trying to let go of the wakefulness and stress to reveal the sleep drive and let yourself go into that place. That's why I like microdosing melatonin instead of heavy doses. Give yourself a tiny little bit, stimulate that natural action in your brain. Your brain will maintain the production through the nighttime. We can measure those as well, by the way. Diurnal cortisol and the ZRT does a sleep balance kit, so 4-point spit or urine, and I can see exactly where your cortisol levels are through the day, exactly where your melatonin is at nighttime, which is pretty cool. But the mid-morning stretch, daylight, water, maybe a snack can be really helpful at preventing the afternoon crash.
Very cool. So we will wrap this up in a few minutes. But the last, I guess, theme I wanted to talk about was blood work. And we did talk about testing a lot. Yes. So a question came in, how often should we be getting blood work?
I think it depends on the provider that you have. In our office, where we know how to interpret the data, the goal is not to overanalyze, right? If somebody's doing well, we're not getting blood work every 3 months. If I'm changing things, I'm probably getting blood work every 3 months. Very rarely more often than that. Thyroid would be an exception if I'm changing a thyroid dose every 6 to 8 weeks. So it depends on what we're looking at, but ultimately what we're trying to do is get enough data that we catch things before they're a problem. So I don't want data once every 3 years. That's not enough. even data once a year is often not quite enough, depending on what we're looking for. But comprehensive data annually to look for trends and early signs of things, and then every 3 to 6 months, so somewhere between 2 and 4 times a year, depending on what we're looking at and what we're looking for, is what we're looking for, and that tends to help. Specialty tests are totally separate if we're looking for yeast or parasites or cortisol or hormones or other things. That's kind of separately from general maintenance.
And that is, I guess, the first step into what functional medicine is and what you do. It's testing. So
it is.
What would
Test,
be,
don't guess.
Yeah. So anything else you want to add about functional medicine in general?
Yes. The key is in the name. And I think functional medicine has gotten this rep for being all biohacking and very expensive and all this testing, and it doesn't need to be. It can be very basic. And it comes from what we've talked about over this hour. If you understand how you are supposed to function, functional medicine, what is anatomy and physiology? What are my parts and how do they work? And we need to focus on that and have everyone, my goal would be that everybody understood their own physiology. How is my menstrual cycle supposed to look? How is my digestion supposed to be? How are my hormones supposed to feel? And if we knew that, we would understand much sooner when something was out of balance and we didn't feel our best, and where we can start to look. Because right now, that's no man's land. We have function, assume you're fine, until you get all the way through no man's land and imbalance to dysfunction. And that's what conventional medicine does. It's not bad. I'm a conventional medicine doctor and a functional medicine doctor. That's what integrative means. People have diseases. I still need to be able to diagnose when something is there, because not everything is a trend from imbalance to disease. Some things just happen. So we need both, but really understanding that how I'm supposed to work in a healthy, optimal way, that's the foundation of everything.
Lovely. All right. Well, we rounded out an hour plus 1 minute. Thank you guys again for submitting your questions. We will continue to do these with other providers at Essential Health and other locations. But I wanted to thank you, Dr. Sierakowski, for answering our questions. Stay tuned for another live, and anything else you want to?
No, I think future ones you'll see some of our other providers so you can get their perspective and get to know them. We all really love what we do. I am exceptionally passionate and talk with my hands a lot. So thanks for tuning in and listening for any part of this. And if you have questions or wish to pursue this for yourself, give our office a call. We do have something called the Wellness Consult, which is a nice, broad, preventive lab panel and an hour and a half with one of our providers. So we love, that's a nice gateway to see where you're at.
Great.
Happy Wednesday.
Is it Wednesday? I think it's Wednesday.
I think it's Wednesday.
Cool. Let's go have a Wednesday, everyone.
Bye, friends.
Thank you, guys.